Hey guys, and welcome back to my channel. My name's Kris and I am a GP registrar living and working in Australia, and today I'm going to be sharing with you something that I probably shouldn't, and that's a lot of the embarrassing moments I've had in medicine. This extends from basically when I started med school until last week. So if you're interested, please keep watching, but of course remember, thumbs up, subscribe, comment, all that YouTube stuff. Now let's get into it. So I've had a lot of embarrassing moments when it comes to my medical career, stemming from the fact that I'm quite vasovagal. So vasovagal is a type of syncope, basically means I pass out. I'm a lot better now that I'm approaching 30, but when I was a teenager especially, oh boy, I ended up on the floor a lot. One of the worst circumstances, mind you, wasn't my fault, but I was assisting for the first time in an orthopedic surgery. I think we were doing a knee replacement. And you've got to wear a certain type of suit when you're doing an orthopedic surgery. So it's a big face shield, I suppose, that kind of looks like a biohazard suit or a spaceman suit. It's got a fan in there for air circulation. That's attached to a battery that you then wear under all of your gowns and garments and things like that. And then you've got your scrubs and then your scrubbed gowns and your sterile gloves and all that jazz. So you're pretty well decontaminated, I suppose. Now, orthopedic surgeries go for hours and hours and hours, and typically the battery packs are only taken off charge when they're full. As a naive medical student, I trusted one of the registrars. Now, I'm a registrar now, so, you know, I get it, but he thought it would be funny to give me a half empty battery pack, or a half full battery pack if you're an optimist, and see how long it would take for me to notice and to ask the consultant if I could go and change it. It's some sort of hazing, I know, and like, I forgive him, he really didn't mean to hurt me. But what happened was, halfway through this operation, as I am helping lever this leg up, I started to feel really sweaty, and that is my first sign, particularly that I'm about to have a vasovagal, as I get sweaty. Then I feel palpitations, dry mouth, and I start feeling woozy, then I feel cold, and then I pass out. So I start trying to focus on my breathing, because over the years I've realized that I hold my breath a lot when I'm operating, or if I'm in an operation or whatnot. Don't know why. And try to do that, try to wiggle my toes, get that blood circulating. And the consultant looked at me and said, "Are you okay?" And I was like, "Yeah, of course, I'm fine. And then I had that cold flush and I thought, I'm not fine. So I put the leg down and promptly passed out. When I came to, the nursing staff had already stripped me of my mask and my gown, and I started crying and hyperventilating because I basically asphyxiated. Okay, that's extreme. I passed out, and it was basically because I was just breathing in like unfiltered air. The registrar came clean and got into a lot of trouble, apparently. But the embarrassing thing was then I got wheeled out and put into the recovery area with everyone who just recovered from their operations. And I'm crying like a baby, being fed, I got water. And I was like, I just want to go back in there, They're like, no, chill, you just passed out, you just hit your head. I ended up going back in there. It took me half an hour or so to recover, but I went back in, helped finish the operation, and never worked with that registrar again. More recent embarrassing moment was when I was in obstetrics and gynecology. I was learning how to ultrasound and figure out if a baby was cephalic, which means that their head was presenting first, which is the way that you would hope to deliver a baby. And I had this woman who was, you know, third trimester, 36 weeks pregnant, I think. And I thought, yep, we've done the fetal Doppler, I can hear baby's heart, I've palpated, I'm pretty sure that she's cephalic. I'd like to ultrasound though, just in case. And anyway, when I got the ultrasound, I polyped it on her abdomen and I went, I don't see a baby. And I sort of, when I was taught to ultrasound for like head presentations, I was told to ultrasound quite low down on the abdomen and just kind of look up. And if you see a round head, obviously it's head down. If you see a foot, obviously it's not. If you see a butt, you know it's not. Now I've been told, you know, put it on the center and then move to appreciate those things. But like, I was learning. So anyway, I see this empty cavity, see no baby, I can feel baby, baby's kicked me several times, machine's not broken. So I went and got the boss of the hospital, OMG, and I said to her, I just can't figure it out. And she'd seen me, she knew that I could do it. She comes in, She puts the ultrasound on the abdomen and goes, "You've been ultrasounding the bladder. This bladder is very full. She needs to go and empty it," and walked out. So yes, there was no baby in the bladder. Go Dr. Kris. Casting my mind back further, when I was in my second year of med school, we were learning how to give a proper handover, or at least present a case. And any med students out there know that they just hammer this into you. Basically, medicine, we like short, sharp, snappy. Yeah? So I have a 47-year-old female from Sydney who presents with acute right upper quadrant abdominal pain, or sharp shooting chest pain, or leg cramping, whatever it is. I, if you can't tell, am quite a wordy person, and it took me a little bit to get to that handover. I'm good, I'm there now. But I was presenting this case. I don't remember what it was about, but say, I've got a 27-year-old female with epigastric pain. She's driven in an hour, and furthermore, I said the word furthermore, and the consultant I was speaking to was like, "Did you just say furthermore?" And I was mortified. She was like, "I can tell you used to be in the debate team." Wrong. Well, right, but I never did debating. I could tell you used to do speeches. Wrong. She goes, "You're just too wordy, cut it down." So I've deleted furthermore from my repertoire. Very, very recently, I was doing a teleconsult with a patient, and at the end of the consult, I like to say something like, "Lovely, excellent, if you have any problems, let me know, see you later." Anyway, I was a bit tired on this particular day, and instead of saying, "That's lovely, I'll talk to you soon, see you later," I just went, "Okay, thanks, love you, bye," and hung up. And I just heard the patient go, "Oh," on the end of the phone, and then I was like, "I'm never talking to her again," or she's gonna be a patient for life. So yes, I have said I love you on the phone to a patient. It's just as mortifying as telling a teacher, "Hey mum." Yeah, been there. So there you go guys, a couple of embarrassing moments of mine. Just thought this would be a fun, quick, easy video to do, and just want to normalize that it's okay to make mistakes in medicine when there's no real significant consequence to patient care. Tell me, what embarrassing moments have you had in your job or in general life? If we want to do a general life one, oh boy, I have a lot of them. But until next time guys, stay safe, stay healthy, and I'll see you later. Bye.